Good evening. This is Dr. John Bennett broadcasting from Miami. Tonight we have a hangout for Parkinsonism TV. We have the pleasure of having Aziz Abdi. He's the executive director of the World Parkinsonism Program, I believe based in Toronto. And tonight, Aziz is going to talk a little bit about himself. He's going to introduce himself, where he got to where he's at, what his program does, and also is going to talk about the World Parkinsonism webinar day tomorrow, I believe. Good evening, Aziz.
Good evening, Dr. Bennett, and it's a pleasure to be on your show. Thank you very much for giving us this opportunity to discuss, to introduce myself and also discuss the World Parkinsonism Program, as well as the upcoming event that we will be hosting on April the 11th on Saturday, which is the World Parkinsons Day seminar. If I can briefly introduce myself again, I am the executive director of the World Parkinsons Program, and this is essentially a non-for-profit organization that was initially established back in 2008 by a Canadian neurologist whom you know very well and is no stranger to your show, Dr. Rana. So essentially, World Parkinsons Program is focused on mainly three key areas of activity. The first of which is absolutely critical, and that's to enhance the level of education on Parkinson's disease worldwide. I think our mandate is both local as well as global, and we have a number of programs that we engage in and execute to really drive the level of education on this disease on a global basis, where we provide a number of brochures, as well as publish handbooks on Parkinson's disease in more than 25 different languages, and distribute those brochures and notebooks to different health centers, clinics, as well as sending it directly to healthcare professionals so that they can further enhance the level of education and also improve the level of service that they provide to their patients on a global basis. So again, the first of the three key areas of activities that we engage in is education, which is fundamental to our core service as an organization. We're also very active in the area of advocacy, which is also a very critical area. And what we try to do there, Dr. Bennett, is partner with government as well as healthcare agencies to really establish policies and also to impact the new policies that all focus on how we as a community deal with Parkinsonism. And our goal there, of course, is to bring forth policies that are going to enrich the lives of individuals that suffer from Parkinson's disease, and at the same time, not just focus on the policies, but also focus on the budget that has been allocated to really focus on improving those lives of individuals that are directly and indirectly impacted by Parkinson's disease. And of course, the third area, and which is by far the most important, is providing support services to the patients themselves. As an organization, the World Parkinsons Program is anchored on enhancing the lives or improving the quality of life of people that are directly and indirectly impacted by Parkinson's disease. And we do that through a number of different vehicles, one of which is, of course, to provide the right level of medical products as well as medical devices to organizations or individuals who don't have the financial means to solicit and acquire those medical equipment as well as the medical products themselves. So what we do is we have an extensive donor base from a global perspective that we try to solicit funding from. And we also have an extensive volunteer network where we try to acquire those medical equipments that are in need by Parkinson's patients. And in turn, once we acquire those, we actually ship them to developing nations that don't have the right healthcare infrastructure or funding to really cope with this disease, and also provide some support where support is severely needed. So again, that's on the education side, on the advocacy side, as well as on the most important side, which is providing support services to the patients. Those are the three key elements that we really try to focus on, developing different initiatives programs, and establishing a fundraising initiative to really pay for that and support patients on a local level here in Toronto, Canada, as well as a global level, specifically in regions that are in dire need, as I mentioned. Those are in developing nations.
Well, so it's a global organization.
Indeed, it's a global organization that's based in Toronto. We do have partnership with various chapters in developing countries, as I mentioned, and we also have engagements with a lot of physicians that focus on Parkinsonism and provide services to patients that are afflicted with Parkinson's disease.
Would you say the biggest number of members are from North America?
In terms of the organization itself, the members are based on the board of directors as well as the network of volunteers that provide programs and services to our patients, and they're entirely based in Toronto. But we also are affiliated with chapters in other developing countries where there's substantial need, and we provide different programs and services and education material. And we're actually in the process of establishing our long-term plan for all the various programs that we're able to provide funding on. So over the course of the next few months, our focus is going to be to really shore up our fundraising capabilities because the need is substantial. And since our mandate is on a global level, what we're trying to do is we're trying to provide as much support as possible with the finite resources that we currently have. So we're really focused on enhancing our funding capabilities so that we can meet all the needs. We're constantly getting requests for medical supplies, educational material, and meeting all that need is going to require a fair amount of fundraising. So that's where our focus is, which is a great segue to our upcoming event that we're hosting on Saturday, April the 11th. And this is to essentially generate awareness of Parkinsonism. And we chose April 11th because it's World Parkinsons Day, and it's a day where we're providing a seminar where we've invited a number of individuals from our local government, as well as a number of physicians that are leading figures within Parkinson's disease to come and give talks. So there's different talks that are going to be given from various vantage points or viewpoints. One would be from, of course, the healthcare professionals, and we have neurologists that are going to be delivering talks during the seminar, as well as physiotherapists who are also going to be delivering talks in that seminar. We also wanted to provide a perspective from the caregiver. So we have individuals that have loved ones who are afflicted with Parkinson's disease, who are going to provide their perspective to the broader audience. And lastly, and most importantly, we wanted to hear from the patients themselves who inspire us in what we do, which is patients that are afflicted with Parkinson's disease. And we have one patient who's going to be giving a talk to present on what it's like to deal with this disease on a daily basis. So I think it's a very comprehensive agenda that we have, and it's essentially focused on, again, educating the public, educating our healthcare practitioners, as well as educating the government members of parliament within our government.
How many
about that?
I'm sorry, go ahead.
So we're really excited about this program and are looking forward to implementing it on Saturday.
Great. Now, how do you go about? You just essentially go into a country and contact. Most countries have chapters of Parkinsonism support, or do you go to the government, or you kind of go through the doctor community? How does that work?
That's a very good question. What we do is we leverage the networks of the physicians that are already engaged with our organization. One of which is Dr. Rana. Dr. Rana is well known throughout the world, particularly in developing areas. And there's a number of physicians who are based there that already have a strong relationship with Dr. Rana, and therein lies our opportunity to engage and partner with them. They reach out to our scientific advisory board, requesting different education material, and Dr. Rana and the broader team within the World Parkinsons Program provide those materials.
Well, that's exactly the way that my website is structured. Is essentially establishing communities of physicians and build around that network. Start with that framework and then build around it.
Absolutely.
One of the things that Dr. Rana said, besides, he's a great guy to work with, very, very nice. He's totally dedicated, as you know, to his patients and Parkinsonism as a disease. And he mentioned that hopefully we'll be able to leverage this technology in educating patients with Hangouts, because the cost of brochures to mail them, etc. And the world is changing. Of course, not everybody. There are some people that can't really afford a smartphone, and of course you want to reach them. And one of the things I asked Dr. Rana, I said certain countries, neurological diseases like Parkinsonism is kind of looked upon as witchcraft or something. Do you find yourself dealing a lot with that in some of the developing countries?
I think that mindset is pervasive in developing countries, and that's a mindset that we're trying to combat with education. I think that's the best way that we can combat that stigma that's associated with not only Parkinsonism but in general mental health diseases across the board. And I think there's a lot of strides that have been made throughout the developing countries, but we still have a long way to go, Dr. Bennett, and that's exactly what we're trying to achieve in terms of developing different priorities for us to focus on.
Mm-hmm. And the educational means in developing countries mostly printed materials and
Yes.
do you have I guess every country is different. You don't get into the local organizing. You're basically based in Toronto, right? Correct?
We're based in Toronto, and again, I think ideally what we want to do is we want to establish a model much like the model that you described, which is to establish a framework with the healthcare professionals at the local level in those developing countries, and then filter out or fan out to the overall communities in terms of how we generate education on Parkinson's disease. But at this point, we're still in the infancy stage in terms of leveraging social media. To your point, social media is a robust platform for us to be able to use. It's also a method by which we can minimize the overall cost, but achieve a greater scale in generating the education and awareness of the disease. So I think that's what we want to look at in terms of how do we best leverage this platform in lieu of the current method that we use, which is entirely printed material, which can be costly as well.
Yes, and of course, it's in real time. If we were just people were watching this discussion now, they would hear it just as we speak. It's live.
Yeah.
Now, establishing. I have hangouts in the neurosurgical community now, and I get neurosurgeons all over the world because originally that's what the internet was intended. I mean, if you think upon when the internet was first started, it was meant to connect the world.
Absolutely.
And this hangout technology is a way that I think Dr. Rana recognized it immediately. He saw that, wow, I'll be able to communicate with healthcare professionals in Pakistan in real time. Like he could be talking like you could be in Pakistan right now. It's the same transmission. It's like you're next door. You have the same quality voice, audio, and you can have discussions on Parkinsonism, the new treatments. There are a million questions I could ask you. One of them recently, Parkinsonism was in the news. They're putting an app on the iPhone. Have you heard about that app for Parkinsonism research?
No, actually, I haven't heard of that, but I'm very keen on learning about it.
Okay. I don't know much about it, but basically, they've established an app where a Parkinsonism patient can kind of log on and keep track of his symptoms, and they hope to establish a database of research and make it easy for patient, because as you know, a lot of people have smartphones, make it easy for a Parkinson's patient to log in and I guess put down certain variants and variables, whatever, and then analyze that data. It's in the infancy stage, just like your organization. It's in the infancy stage, but it's an innovative way to gather, not only in Parkinsonism, but I'm sure in other areas it'll be used for research.
Yeah.
Without someone having to sign up for a trial to go take a bus and go there and give the data. They can do it easily from a smartphone.
I think this is indicative of the general trend that we are seeing. I mean, I am on a professional basis, I work within the pharmaceutical industry. Even though my academic background is neuroscience, I have been working within pharmaceutical industry over the course of the last 12 years. And what we're seeing is exactly that. We're seeing a trend towards self-care. And what's facilitating that trend is access to information by individuals through social media, such as applications like the one that you just discussed.
Mm-hmm. Yeah, that brings up another point. Why don't we go into your background a little bit, Aziz? Where'd you go to school? Where'd you go to college? What'd you just major in, etc.?
Yeah, so I went to school at I attended at the University of Toronto. I graduated with an undergraduate degree in neuroscience. I initially did my research on mild traumatic brain injury and the onset of depression following mild traumatic brain injury. However, I decided to work in industry, and as I mentioned, I then decided to seek employment within the pharmaceutical industry, whereby I was working for world-class pharmaceutical companies such as Bayer Pharmaceuticals. I'm currently the head of operations for Pfizer Canada, the consumer division. And I mentioned that I'm also the executive director on a volunteering basis because, again, neuroscience is something that resonates with me, that I'm very passionate about. And in particular, neurodegenerative diseases are something that I've always been very, very focused on. So this allows me to reconnect with my academic roots, if you will, while at the same time providing that management experience that I do have and expertise that I do have to an organization that is engaged in activities that I'm very passionate about. So this allows me to leverage my academic background while at the same time providing my expertise on a voluntary basis to really be a part of a worthwhile endeavor that's close and near to my heart.
So your organization in Toronto is mostly local neurologists, or they come from other areas of the world?
Just if I may actually even talk about the board of directors.
Sure.
Broad range of skill set as part of the members of the board. And again, they're patients, they're neurologists on the board. They're various individuals that work in multitude of industries across the board. And that gives us the ability to really capitalize on the diverse skill sets that we need to bring to bear to combat this disease in many forms. So again, we're right now formulating where we want to prioritize in terms of meeting the local needs as well as meeting the global needs. And again, I think you're very much aware that the needs in essence are immense, and it's just trying to identify where to prioritize with the fixed resources, both monetary and human resources that we currently have.
Mm-hmm. Okay. Can I go more into your background? In the pharmaceutical industry, what did you do?
So I initially worked in Bayer, working in the consumer side of the business. So looking at OTC products, and then I went over to AGFA, which is another company that works on developing and manufacturing medical impacts equipment, so X-ray equipment that's utilized for CAT scans, MRIs in the hospitals. And then I gravitated back to work at currently where I work, which is Pfizer Consumer Healthcare, again working on the OTC side. And what we do is we manufacture and distribute iconic brands such as Advil. You live in the United States, so I'm sure you're very familiar with Robitussin, Centrum multivitamins. So that's what I do on my professional life. But in terms of on a volunteering basis, I'm very much engaged with Dr. Rana to really focus on delivering programs and services that cater to patients of Parkinson's disease within the World Parkinsons Program.
How did you happen to pick Parkinsonism to go into as far as volunteer work?
Again, my background is neuroscience, and essentially mental health diseases across the board, whether it's Alzheimer's or Parkinson's disease, is something that I've always been passionate about. Dr. Rana was able to reach out to me to be part of the board, and shortly after joining the board, my colleagues on the board actually nominated me as part of the to become the executive director. So that's how I became introduced to the organization, and I'm very fortunate and honored and quite frankly humbled to be part of this initiative.
How often do you guys meet?
We meet face to face on a monthly basis.
Okay.
But we also have periodic conference calls. Actually, over the course of the last few weeks, we've been having various engagements in preparation for this initiative that we're hosting or holding on Saturday, the World Parkinsons Day seminar.
Well, hopefully you guys will get to meet by Hangouts in the future.
Well,
you'll have your board meetings by Hangouts.
I'm certainly looking forward to contributing to your Hangouts. And again, there's a number of ideas that we have in terms of really delivering different capabilities to increase awareness, to increase education. And I think your platform is one that's easy to use and user friendly. So we'll be leveraging that in the near future. Yes.
I think my experience has been that people, especially neurological diseases, because I've interacted with various ones, dystonia, multiple sclerosis.
Yeah.
These support groups, a lot of the patients have difficulty making it to meetings.
Yeah.
Physically, because they have their child to watch, they can't get a bus, they have to work. However, most people nowadays have a computer, and they can. I foresee, and again, this is very, very new. But I foresee patient support groups on the internet, like Hangouts, where you talk to each other, and you know, especially neurodegenerative disease, where people have a hard time getting around.
Absolutely, and I think the capabilities are boundless in terms of how we can use it and what we can do with it. To your point, it's difficult, especially in today's life. People are engaged in so many different priorities. To find the time to make the time to be a part of a board meeting can be challenging at times. And this ultimately makes it even more easier for people to engage and to congregate to make an impact on other people's lives.
Yes, one thing a doctor always likes to hear is that how can you save time?
Absolutely.
Because as you said, people nowadays are so darn busy. I can't remember a time earlier in my life when people were so darn busy. If you can show doctors, especially, I know, how you can save time, wow, they will listen.
Absolutely. Well, Doctor, I really appreciate your time. And again, thank you very much for giving us this opportunity.
Yeah, okay. It's a pleasure, Aziz, and I look forward to working with you in the future. And any ideas, just shoot them by. And let me just end the broadcast, and we'll chat for a second. Good night, world.
Yeah.